So you went from Uber Eats, which is a fast-moving B2C marketplace, now to a highly regulated B2B healthcare company. What has been the biggest mindset shift in that change for you?
I think the biggest change which I encountered, so that's also because of my position in data. So in most of the companies I've worked in, you would always assume that everybody in the company has access to all the data. And so basically you hire smart people, push them to be very data obsessed, and then make data-driven decisions. But because we are in a very regulated space, a lot of the company doesn't have access to all the data. Some of the company has access to only fraction of the data. Like there are restrictions around data residency around a particular country. So people not working in that country don't have access to a lot of data, which is very, very different. Another challenge is, the downside of making a mistake in food delivery is your food arriving late, getting a bad rating. Of course, there is a downside. No company wants to have a bad experience with a customer. But in health tech, the downside is somebody not recovering for the entire life. Like if you do wrong exercises, you make some mistakes, hire fast, maybe PTs, and they're not so good, and they end up doing wrong exercises, their health can go downwards for life. So while the downside there is probably a bad dinner, and here is like 40 years of paralysis or stuff like that. So most of the ride-hailing food delivery companies, especially like Careem, Uber, that space was like move fast, and move more and more and more fast. Run a lot of experiments. Marketplace company run a lot of experiments. Move fast. Any experiment you think of, you have the freedom to run it all. Not a lot of check in there. But in health tech, every product you launch, large changes you make, you need to discuss with your clinical team, maybe external folks as well, like FDA, and of course, our clinical team does help out with those, but you still have to discuss with them before making large changes there. So that's a very important change.